My name is Mesrani Arti Simanehoruk. I am a student. Some time ago, my teacher gave me a case study, and he wanted me to respond a question about that case study. And now I will read the case study first. Case study 2. Physician's rights. Dr. M was an obstetrician and gynecologist. He performed an abdominal hysterectomy on Mrs. H, a 53 years old patient. Prior to the surgery, Dr. M informed Mrs. H of the risk and potential complications of the procedure. He discussed with her the general anesthetic she would be receiving and its possible complication. He told her about the potential of injuring other organs adjacent to the uterus, including the bowel, bladder, uterus, and rectum. The risk of bleeding during and following surgery was discussed with her, as well as the risk of post-surgical infection. After Dr. M had disclosed all material risks attended to the surgery, Mrs. H consented to the operation. Dr. M had been suffering from epilepsy since 1989. Information he did not disclose to Mrs. H. Dr. M did not suffer an epileptic seizure in the operating theater during Mrs. H's operations, nor were his ability to perform the surgery affected by the medication he was taking. During the 2 days subsequent to the surgery, Mrs. H's bladder failed to function correctly because an incision had been made to the bladder during the initial surgery. A urologist was called in to repair the damage to the bladder. Early the next morning, Mrs. H passed away due to a pulmonary embolism in her lungs. And the question is, should Dr. M disclose to Mrs. H prior obtaining to her consent to her surgery? My answer is no, because, in my opinion, Dr. M should not be disclosed his epilepsy in obtaining Mrs. H consent. Dr. M has his own rights not to reveal an obligation to care for his patient in the best possible manner. Dr. M kept his illness from patients to make them trust, as long as his medical condition does not harm his ability to perform surgery. He had informed concern for Mrs. H about risk and potential complication in the procedure, and Mrs. H died because of risk of surgery, not because of Dr. M's illness. Finally, that's my response of the question, and thank you.